Hello to everybody and welcome to what has become our traditional appointment twice per month to explore the different facets of all the topics which are related to antimicrobial resistance and to learn from a different range of related issues. I'm particularly happy now to welcome our dear colleague Masami Takeuchi, a very long standing colleague and friend who does a very interesting work and is going to share with us about her experience and about the work at FAO, looking at residues of antimicrobials and interesting tools that they've been developed. I would like to benefit from this opportunity to thank the different initiatives that are allowing us to organize these webinars. The Renofarm initiative, many of you will be familiar with, the FAO Network on Sustainable Livestock Development, and also the ACT project financed with funding from the Republic of Korea. And with this, I think we can go to next slide, please, Marina. I think by now all of you are quite familiar with the webinar etiquette, but just to remind everybody once more to keep your microphone mute. If you could please rename yourself, writing where are you coming from, which country, which organization, so that we use this opportunity also to familiarize with each other. This is an FAO webinar. We are normally not responsible for information which is portrayed, but still, please refrain from advertising in the chat your services, company, or any commercial product or brand. As you know, after a talk, Masami will be available to address your questions, so please write them in the chat, and at the end of our talk, she will address those. And please remember that, as usual, we will share the presentation, but also the recording of this webinar. So you will be able to look at it again, to share with your colleagues or with everybody else who is interested. It will be posted on the FAO YouTube channel, so available to everybody. Next one, please. Yeah. So I think now, before starting and looking at the future, we can give the floor to Masami. And thanks, Masami, to start your presentation. And of course, Masami bio is on the link we have shared. So I'm not going to spend any precious time on that. But if you want to know more about that, you know you have all the information. Thanks, Masami, for being with us, available. And please, the floor is yours. Thank you.
Thank you very much, Daniela, for the very warm welcome and then also the very nice introduction. I'm very excited to share what I have been doing to this platform. And my belief is that this audience that we have here is quite familiar with the AMR, that antimicrobial resistance, but then potentially that a little less on the issues of the residues. And I am a food safety officer at FAO based in Rome, Italy. And I am thinking that my work from the food safety angle could potentially add some interesting knowledge to you today. And then hopefully that you would enjoy what I am going to talk about. So my presentation is titled From Residues to Resistance, the Dual Role of Antimicrobial Residue Monitoring. So I am focusing on the residue monitoring, and then I'm talking about dual because originally that and then traditionally that the residue monitoring is basically for food safety. But then now that we are looking at this issue for AMR management or the efforts to tackle the reduction or slow pace of the antimicrobial resistance development. So that's my talk is going to be. And first of all, that like I said, that there are a few issues that we have to remind ourselves that why residues matter to all of us. And then, of course, that first of all, that nobody wants to eat drug residues in our food. So this is the main concern that in a food safety arena, that we really want to ensure that the residue level is at the very lowest, this acceptable level in the food. And then of course that if we don't control very well, that this will reduce the consumer trust. And then this is a very big deal, because once trust is lost, that it is very difficult to regain. And then second, very important and almost essential element that we have to remind ourselves is that animal is important, livestock is important sector, and then if they get sick, we have to treat them. So it's not that simple that just because we don't want residues, not using drugs is not the case. So it's very important that the keeping the animals healthy and preventing them suffering is a responsibility of humans. So this is something very important element sometimes that we tend to forget. And then that's why that we have to strike a very good balance between them, and then how we can still keep using the drugs effectively, but then how we can ensure that it doesn't leave any food safety issues in the food. So this is the very much nutshell of the residue issues. And like I said, when we use drugs, right? And then first of all, the treatment is necessary. And then sometimes that the prevention, for example, vaccine, and then all different prevention methods, some veterinary doctors use those drugs to treat animals. But then, of course, that when we use medicines to treat animals, there's always a risk that the drugs will remain in the body and then the tissue, so that it can go into the food chain through meat or milk or eggs or sort of things like that. Therefore, that we need to look at this issue of AMU, the responsible use of the veterinary drugs. But then the solution isn't zero use. And this is about how, when, how much, how frequent we use those drugs. And then we often need to understand that what kinds of drugs for what purposes we are using to treat animals. And here is the real question. So we shouldn't ask ourselves that how do we eliminate the residues entirely? Because like I said, it is essential element in livestock management. But then we have to ask ourselves that how can we manage them safely? So I would stress again that the right question is about balance. So we do have to have some very good system that we are able to ensure food safety, but then at the same time, we have to have a very good balance that we are treating animal health and then also the public health together. So this is the perfect picture of one health element that we are taking a look at this issue as a coherent way, and then we strike the right balance so that it will be in a sustainable way to support both animal welfare and then also safety, and then animal health, and then public health. So going back to what they are, the antimicrobial residues, and then I'm talking like almost interchangeably, that talking about antimicrobial residues and veterinary drug residues. But then from food safety point of view, that drugs do not have to be antimicrobials, but then majority of the drugs could be antimicrobial medicine. So I am just using both, but then in general, in the food safety area, that we call it residues of veterinary drug residues. But then antimicrobial residues are tiny amount that can remain in the animal derived food. And then mostly, as you all know, that this withdrawal period is the most important thing to manage residue levels. So I understand in the real life situations that when the farmers or the practitioners use the drugs on animals, but then next day suddenly there are buyers coming to buy these animals, that live animals to be butchered, then the normal thing is that those producers want to sell it off when they can sell, then not thinking about this withdrawal period, but then this animal is sold and then butchered and then sold as a food, as a meat or any animal derived product. Then the problem is that then this meat will have probably excess amount of the residues in the meat. So that's why that this is very important that everybody knows about this. So trainings, knowledge transfer, that everything that we do at the right level has to be translated into the first primary producer. So this withdrawal period violations are quite common observation that we see in the field. So this is one way that the excess amount of residues can be found in food. Another instance is off-label use. So sometimes that this is sad, but then in the reality case that we see human antimicrobial used on animals or vice versa sometimes. And then sometimes that some drugs are used for different purposes that without knowing or with knowing the real impact of the medicines. So this is something that we often see, unfortunately, and then using the drug outside of the approved indications, dosage, and target species. And then this is something that we need to tackle. So this is very closely related to the AMU, the antimicrobial use issue. And then last one is overuse. So excessive or even small amount that a prolonged treatment without the necessity beyond recommended therapeutic protocols often cause this problem of the excess residue. So those are the things that we have to remember, that how this excess residue happens, and then mostly, of course, about AMU, potentially the knowledge issue, that is one chunk, but then other elements that create this residue situation is not only about knowledge, but more of the system as a whole. That if there is drug distributors, they are freely, marketing their drugs, and then farmers not knowing what drugs they are, and then they are using it, not knowing about withdrawal period, or not knowing the real purpose or real effect of the drugs, or how much should be used, for what treatment they should be used for, then all entire systems make this problem to be a very complex. Therefore, in food safety, we have something called MRLs. So this is basically the threshold. It is standing for the maximum residue limits. And this is critical, specifically because this is something that I am talking about as a balance. This is the very, very core thing, because food safety's work is to determine that how much is okay and then how much is not okay. So this is a very important threshold. And then MRL is usually set based on extensive toxicological study. And then also exposure matters, because for example, if I am using certain type of meat every day versus I eat it once a month, it changes entire story about the exposure. So we need to know that what is the normal exposure in certain population groups. And then also the margins matter. So it's not like a very limited amount of the residues that we are talking about, but then we are thinking that even though it is a very trace amount of residue in certain food products, if this accumulate over the long time, that there are certain levels of accumulations. And then we have to think about this time, frequency, dosage, and everything in between, and then still put huge scientific margins so that even if the exposure is large, that those vulnerable population can be safeguarded. So these safety margins, long-term consideration are already put into the scientific considerations and calculations of MRLs. So MRLs are the cornerstone of food safety. We are using it for veterinary drug residues, pesticides, lots of chemical contaminants or residues, and then providing robust scientific driven regulatory framework is based on those threshold MRLs. And then this is really vital to safeguard public health in the food safety angle. But then here is the inconvenient truth in the chemical food safety. I would say everything can be very great, safe, or everything can be toxic. So even just water can be very toxic if it is excess in consumed. So the dose makes the poison. So we need to know that it's not that what is matters, what matters, but then it's more on how, and then how much, and then when, and then the how frequent those dosage in the long term matters. So we shouldn't be using this principle of zero tolerance. I am repeating one more time, but then we need to know that each drugs have safe level. So it is okay to have up to MRLs, but then we need to focus on what is excess. So this is something that the food safety, for food safety, very important in chemical area. And I have stressed enough that how much, but then how often, that's the issue. So if we have a single low level, even though that is above MRL, exposure to residues, it could be completely harmless to human health. So this is something that we need to know. So one-time consumption usually should not matter. But then multiple exposure, even a small amount, we need to start thinking that can potentially cause chronic health impact. Then MRLs is not for the single exposure, you understand, it is for the long term, and then also very cumulative health impact. So MRLs consider acceptable daily intake, and then also the cumulative effects over a lifetime of consumption. So if you see MRLs of the veterinary drug residues, you can already think that, oh, this is already considered all this. The question is, who sets those MRLs? So first of all, that the main the body that sets MRLs in general should be national competent authorities. So it is often in many countries that the standard setting bodies, like a Bureau of Standards, sometimes it is a health authority, like the Ministry of Health, or sometimes it is commodity based. So sometimes there is a MRL set for livestock products, or there are some MRL set for some different products like dairy products or eggs. So it depends on the national situations, but then usually individual countries or jurisdictions typically set MRL standards for their domestic food supply. But then in low and middle income countries that I observe a lot, that there could be some limited technical or financial resources to develop those MRLs independently. Therefore, that international organization come in And then there is the joint FAO-WHO expert committee on food additives. They have a separate group called the JECFA for RVDF, which is the residue of veterinary drugs. So they provide independent scientific advice by evaluating toxicological and exposure data, and which serves as a critical input to set MRLs. So JECFA gives their scientific advice to the Codex Alimentarius Commission. Codex Alimentarius is the international food standard setting body. And then all the member countries make this body of the food standard setting. And then Codex Alimentarius is using this JECFA scientific guidance to discuss the international food safety standards on a wide variety issues. But then this veterinary drug residue issues is also one of them. And then setting those MRLs so that this international codex MRLs, the standards, can be used by low and middle income countries to access those scientific advice and then utilize those international MRLs to be integrated into their national system so that it can be harmonized with the global MRLs. But then most of the countries would need a little bit of tailoring needs there, because exposure can be very different from depending on what kind of food consumption patterns exist in the particular population groups. So Codex Alimentarius MRLs are very good and then ready to be used, but then at the same time, many countries review the MRLs to see that if it fits their needs in the country context. So I put this green label and red label on the screen because this has been usually the residue issue monitoring scheme in food safety. So what happens is that Food Safety Competent Authority, traditionally, long time ago, used to check for the residues, the test and analyze, and then see that if the residue is below MRL or above MRL. And then if it is below, green flag, that safe for consumption, everything is good. If it is above the MRL, red flag, something is wrong, that the AMU has a problem, and then we need to do something about it, and then cannot be sold in the market. So this is like binary approach, and then it actually gives us a very straightforward feeling. But then the sad thing about this binary approach is that this finishes here. This entire story ends here. If everything is below MRL, finish, and then no more questions. And then red, don't sell it, and then finish, and then end of the story. So this is not going to tell us the complete story. So we think that it is not enough. And then we don't want to use this binary pass and fail results forever, because we need to have a full picture. So what does it mean? What if low level residues of high risk drugs exist and then are monitored across multiple samples? So it's still low level. Okay, no problem in food safety, but then we want to know what it means, what this trend tell us. And then what if there are a few areas that where we find lots of red flags? How much residues excess that we are finding, and then what drugs that we see a lot, and then what commodities are attributed. Those kind of things will tell us that some sort of geographic clustering, meaning that we may be able to see some hot spots, and then there could be indicator that this is telling us that something is not going well there. And then we may have to have a very intensified training or some sort of knowledge sharing, or information has to be provided. What if this violation on AMU is strongly connected to the residue issues, then it is very useful data that we can really generate from the residue monitoring. And then also there could be a temporal trend that we may be able to find over time. So it is very low-key indicators that we may be able to find some increase or decrease or hiccups. So we need better intelligence to understand these patterns and their implications. So pass and fail doesn't tell us. So we need proper monitoring. And then also, in addition, that I want to talk about this connection between residues and AMR. So residues do not suddenly directly create AMR, but then it may contribute to development of AMR because the residues can come into food. That means like it can be spread to the environment through human, through animal, through the fact that residues exist. And even residues below MRL, there could be residues that in the environment could be in the cycle of this life cycle. Then it could impact bacteria communities in the microbiome or environment, water, soil. So I think that this is very important to at least know and then identify the patterns of AMU that misuse. And then that could be potentially a good understanding to have this antimicrobial resistance development. So this is something that it was not used to be checked before in the food safety arena, that we have been seeing that does it kill us, does it sicken us? But then we didn't think that, okay, let's document, let's look at the numbers, let's see long term to see that if it is affecting this AMR. So this is something that we think that it is a very important set of data that could contribute to the better management of AMR. And then, like I said, that the monitoring is important beyond the compliance, but then I am not saying that the low-level residue is dangerous. No, it is not. In food safety, if it is below MRL, it is okay. And then I am just saying that quantification, overuse patterns, if we see banned substance, any kind of potential problem chunk that we find, that could be a very good reason to do the follow-up action. So it's not about identifying the bad practices right away, but then it's more intelligence. It is contribution to the better intelligence. Particularly, we are talking about potential use of AI in the future. If we have good quality of data, that could be very useful in the future. And I have been repeating this many times, that this is a window into AMU. If the residue is being checked, that if AMU is not managed very well, this may indicate some sort of misuse of veterinary drugs. So this could be very good validation process if we start having a data, if we start having a trend analyzed. And this is the perfect situation, perfect case study, I think, that to show that this is the One Health connection. Residue can affect all 4 areas that I have highlighted here, from human health, animal health, environmental health, and then also the policy, the regulatory integration. And then FAO has developed this tool. It's called FAO RBDF tools, residues of veterinary drugs in food. And this is a tool that national government can use to understand where they stand. So many times that the countries say that they have nothing, no capacity, we don't have anything, we don't have data, because to tell you the truth, only a handful number of countries are currently doing the active surveillance of the residues. So majority of the countries in the world do think that they don't do enough. But then this tool is actually revealing very quite often that they have a foundation. Even some low and middle income countries I have visited, they do have something already so that they can build on their capacity over it. Many countries says that we don't have data, but then if I go there, I do find some sporadic data that can tell us something. So this RVDF tool is very precise assessment, although this assessment can be done in 3 days. It's a very short one, but then it can really pinpoint to the national authority that this can be the starting point to make the situation better. And then we have a laboratory module which can assess the capacity of the laboratory, which can test and analyze the residues. So these two monitoring modules and laboratory module can put together, and the national government can understand where this improvement can start. So where the gaps exist. So it is a very actionable, very practical tool that the FAO has developed. And so legal framework, sampling strategy, interagency coordination because of the One Health nature, and then data management, they are the elements that this VDF tool focuses on and look into. And in early time that we piloted this this tool in Thailand and in Singapore. And then this year, we have done the further pilot with the latest version in Pakistan and Ghana. And then they are already showing some very good output. We are really identifying the multi-sector collaboration, not only needs, but then the collaborations that are already happening. And then we are able to identify lots of gaps that they might like to start filling. And then the tool is naturally set up so that actions can be listed as a recommended actions point, and then this planning can start right away after using the tool. And coming soon that the Lao PDR is wanting to use the tool in later this year, November. And then now that the preparatory activities are happening, stakeholder mapping, and then also the connection with the AMR efforts, and then preparation of the baseline data, and then training, those are things are happening in the Asia Pacific region. So in the end, that the tool shows the visual radar chart and then priority gap analysis, and then a shared understanding among very much different stakeholders so that they can start the action planning together in the integration to their AMR planning or food safety planning or One Health planning. And eventually that this will connect to the enhanced surveillance of food safety because it's an active food surveillance. And then we can conduct the targeted interventions. And then as a whole, it can be coordinated as a cross-sector action on AMR. And this is probably fourth time I'm repeating this, but then this will support good practices in AMU because residue testing can validate, can indicate it certain AMU issues. So the take-home messages. So drugs, veterinary drugs are essential, but then responsible use is necessary. And then I want all of you to take this MRLs, this acronym to take home, because this is the key terminology in food safety for the residues. And then they are science-based protection. And then beyond binary decisions. So green flag, red flag are not enough. We would like to see the quantification, trend analysis, long-term impact. And then I cannot stress more, AMR connection is becoming so key, so important. And then FAO-RVDF provides practical supports, but then we do need cross-sector supports. We need food safety, we need human health, we need drug authority, we need livestock, fishery. That cross-sectoral collaboration is important. So with this, that I will give the floor back to the facilitator, Daniela, that I put some what's next, but then hopefully that some people have asked some questions about the next steps. So over to you, Daniela.
Thank you very much, Masami. Fascinating presentation. And thank you very much for not only providing an overview of your work at FAO or its outputs, outcomes, but also to give us so much information about important institutions like the Codex Alimentarius and the work of this institution and how they link with the work you're doing and the work of our colleagues. I'm particularly happy that from the very beginning to the end, you stressed how important the responsible use of antimicrobials is for not only for the health and welfare of our animals and of course for public health and so on. So it's very important to stress that component. Also to give information on how the work on monitoring the residues of veterinary drugs and antibiotics can give information on what are the good practices. So really showing how all our work is linked and showing what is the One Health approach in practice, linking the different disciplines and the different work. That said, I see already that there are many, many questions. So we'll start from the first one. And it's Rakesh Sondia, who is working in a lab, who is asking to explain about extraneous maximum residues limits and how you evaluate those for residues testing in milk. I think is working in a milk in the lab associated with the dairy industry.
Thank you very much. Very good question. It is a concerning issue in milk, isn't it? But then overall, the residues of the veterinary drugs, basically how the toxicological assessment is conducted is basically that substance-based assessment. So they take certain drugs, and then they take that substance that is effective for the disease or the conditions. So substance is usually assessed for the toxicological study. And then also the ideas of that what elements of this drug is effective to treat the diseases, and then what kind of elements of the chemicals of this drug is not affecting the overall food safety issue. So this is something that they clarified first, then a toxicological study is done, and then after that what happens is that if this drug is used for example, that the milking cattle, then the consideration is given that, okay, that the drug can be remaining as a secretion of the milk. So then if that is determined that there will be an exposure assessment start happening. So basically that if this is in the milk, that how much milk we are talking about, how much residue is acceptable in the acceptable daily intake. And then also for the long chronicle studies, that what is the potential accumulation, what could be the harmful level of the drug, so this particular substance that is effective, and then how this can be assessed in the further long time, sometimes very much long as a lifetime, the chronic impact. And then all those, the toxicological study and the exposure study are put into the modeling so that the margins that I have been talking about will be considered. So for example, you may have heard of this kind of margin consideration, but then sometimes margin is considered for the impossible level. For example, if you drink the milk, like 300 glasses of milk every day for the next 30 years, years every day, and then this is going to become harmful. Then nobody drink 300 glasses of milk every day, and then also every day for the next, I don't know, 30 years, 50 years, 80 years. This is how the margin is considered, and then each drug and then each attribution to what commodity, what animals received these drugs, that there are different varieties. So I hope that answers your question.
Thank you, Masami. And we have really, really many, so we have to be selective, maybe giving, okay, but I think that the reply is very comprehensive, is very good. So we have a question from Ludovic Pelligan in UK. One issue we have is harmonization of MRL across different regulatory areas. For example, in some animal species, the list of MRL from EMA is more extensive than the one of Codex. What do you do when there is no MRL reported for an antimicrobial used frequently in a given animal species?
That is a very tough question. Thank you very much that we do talk about it a lot. That, that the term, that harmonization is tricky, isn't it? Because I try to use this term very in a careful manner, because when we say harmonization, what do we mean? That the harmonize what with what? So, for example, I understand that because I work a lot with the EU experts and then EU experts and then also UK experts too, that they have already traditionally analyzed these certain veterinary drugs already. And then countries are already using those MRL set at the national level. And then now that the JECFA, that the international the expert committee, is also working on the MRL. And then, okay, now that, like you said, there could be a situation that two different MRLs exist in the world. So do we harmonize which one to which? So this is the big question. And then we have to think about that, okay, so harmonization at the political level, regulatory level, may not be the most suitable terminology. But then what we have to think as a scientist is that what is relevant, right? So it started becoming very important that exposure level. So it is because science for the toxicology is more or less the same basically, but then how much and then how frequent, what is the practice in the country level, and then what is the magnitude of the livestock production system. I mean, those kind of things become more relevant to set the national-based MRLs. So we are saying that harmonization completely may not be instantly achievable, but then we need to look into the numbers and then data and then also the exposure level to see that if it makes sense to use the different MRLs in one country to another. So this is more scientific approach. And then we use rather aligned term rather than harmonized term, because we don't have to have exactly the same, but then we have to have a very similar principles and then similar approach to think about what drugs have what kind of impact, and then how much residues that we have to think about, and then what food that we are talking about. So it's not a super straightforward answer, but then my answer is that alignment and then international conversation, the collaboration is really important.
Thanks again, Masami. And now we move into a slightly different topic. So somebody is asking if there are studies on persistence of residues in the environment.
Yes, it's true that persistence in the environment, as I think this person is talking about resistance rather, or is it about the drug effect persistence? Which one is it, do you think, Daniela?
I think it's about it's about the residues. If the residues are ending up in water or soil, for instance, at least that's my understanding.
Okay, yeah, it happens because one instance that I know, which is not comprehensively understood, but then, for example, there is the aquacultured fish pond, and then there is very careful feeding practices happening, no antimicrobials used for those aquaculture fish, but then somehow that when they tested for the resistance, then they find in the fish that there is a resistance gene for certain drugs. So everybody get confused because no drugs have been used for the fish, but then somehow that the fish is demonstrating this resistance gene. So we had to look at the different source of these drugs, and then we look at this water and then the soil, and then environmental impact of the potential residues inside of the environment. Then it may transfer into these fish, then it could develop this resistance in the fish. So this is really a new issue that we are getting very confused, and then we have to look further in as a research. And then I think that this is possible, and particularly through water. So I think that this is something that the residue and then AMR can work together, and then we can find out what is the good solution, and then together integrated in the planning so that we can really tackle these AMR issues through the residue angle. Thank you.
Thanks again. Another question from India. How do the varying countries-based MRL affects global trade?
That's a very good question. It does, like if, for example, that the importing countries are posing very strict MRLs to the export countries, that this creates the trade dispute. It is a huge problem. So Codex Alimentarius is basically to resolve this issue, because Codex has dual objectives. One is the public health, which is the food safety, but then another one is the fair practices of trade. So Codex aim is that by having a global MRLs at the Codex level, at least that this will show that what science is saying, and for the generic MRLs for the various different drugs. But then at the same time, that this MRLs that the Codex set is voluntary. So countries do not have, how do I say, regulatory binding to follow the Codex standards. But then there is a new element starting like 10 years ago that from WTO, the World Trade Organization. So WTO says that when there is the sanitary and phytosanitary SPS the dispute among the trading countries, then they will look into the Codex standards to say that to make the decision out of this dispute solution. So all of a sudden that the Codex standards, including those MRLs for the residues, becomes the benchmark for those kind of trade dispute. So countries are, the Codex members who are also WTO members are now that mandated to follow and then use Codex guidelines, Codex text and standards as a benchmark for the SPS related issues. So I think that this is somewhat contributing to solving this kind of trade dispute. But then this questioner is correct that this is creating the trade issues.
Thank you. And there is a slightly similar, slightly different one. Somebody would like to know about how AMR affects trade, especially in developing countries.
Yeah, okay, very good.
The difference between developing and developed countries.
Right. In fact, that this is exactly the motivation for FAO to develop this FAO RBDF tool that I have talked about. Because right now, like I said, majority of countries, not only the low and middle income countries, but the majority of the countries do not conduct this active surveillance of residues. So only like handful numbers of countries are able to really do this active surveillance of the residues. But then if those super developed advanced country is the importing countries, and then they are pushing this very strict rules about residues, like rightly so though. This is because of public health issues and then also the MR issues. But then if this is really put on as a trade table, of course that the low and middle income countries who are exporting countries will face this kind of compliance issue from the importing countries. So I think that this gap is becoming wider and wider and wider. So this is what I have observed. And then when I was working in the region of Asia Pacific, and then that's when that lots of countries came to me that this is the situation that I am facing this trade requirement. And then my country doesn't have this capacity. We don't even have we don't have the knowledge of where to start. And then countries, the importing countries, are asking that I need national residue monitoring plan, the annual one, and then sampling numbers and methods and then commodities and then everything. And then I don't know where to start. So that was the request from the multiple countries. And then I realized that this is really a tough issue for low and middle income countries, particularly in the trade context. But then important thing I want to highlight is that, of course, that this entry point can be this trade challenge, but then if we really focusing on trade, it's possible that we may be able to handle this exports to comply with this required residue level that the import country is requesting. But then what happens is this very unfortunate double standards, right? Because then we don't check the domestic products, and then we only check for the exports. And then this is a disaster for the low and middle income countries, in my opinion. So therefore, that I am trying to have this tool to be used to assess the situation, but then at the same time that to train everybody from for the supply chain, from the farmers to the government officials, to understand that this is to protect their populations, not the population in the importing countries only, but then this is also to be applied to the domestic regulation. So I think that this is a very good entry point to comply with the trade requirement, but then this is the opportunity. Let's put it spread to cover entire food control system in the country so that everybody will be protected, and then also the data can be useful for MU and then also AMR.
Thanks again. I think we still have time for a couple of questions. Are we going to somebody was saying Mohammed Popal is working with the Afghanistan Food and Drug Association in one of the Afghanistan province. And he would like to know if agricultural drugs have bad effect on packaged food. So if they're in the same container. So I think if there is a kind of contamination.
Yep, I mean that it's not that residue transfer from one place to another, but because this is somehow residue is embedded in the product. But then I think it is a very good point that sometimes I think that I don't know much about Afghanistan, but then quite a few countries that I have observed, they have different, how to say, oversight is given, that the live animal is controlled by certain ministry or certain department, but then once it's butchered, another ministry takes care of it. And then if it is cutting into the pieces and processed, a different agency. If it is packaged, it's completely different. These are different, let's say, that silos can be existing. So I think that the transfer of the residue may not happen, but then same products can go through all different sectors. So if it is the same lot, let's say same animal, same same treated animals, it is possible that the residue levels are the same. So because the same farmers, same practice, and then, like the same way of transfer. So I think that this is important. Those different agencies have this knowledge that not only the livestock sector, but also the packaged food sector or health sector, everybody knows that this could be a problem for their food products.
Thank you. And I think we have time for one very last one. Okay, so it's from Kevin Otieno. How can local authorities ensure the farmers are not abusing veterinary medicine? For instance, if farmers routinely use antimicrobials as preventing therapy, and they eventually end up in food through the residues. You mentioned that occasional exposure to residues below the MRL is safe. What about the additive effect that comes with exposure through the food containing these residues? And is saying that recently Kenyan Parliament has discussed unsafe level of pesticides residues in farm produce following publication of research findings by a local university. Do you want to address it? There are more explanation, more information about that, but I think you have the main question.
Yeah. Okay, that's a $1 million question basically, because it is mainly about AMU. So I understand that most of the countries do not have as strict rules as human medicine management for the veterinary drug management. I understand because, for example, if we, the human, get sick and then we have the doctor's prescription and then we go to the pharmacy, so we know exactly that what drugs to buy, and then the pharmacies know that they can only sell certain types of drugs, antimicrobials, to what dose and then how much to sell. But then it is not always the case for the veterinary drugs, aren't they? So basically, that is usually the case for many, many different countries, that there could be veterinary drugs available in bulk. There could be these drug distributors just freely selling to farmers that, oh, this is good for your cattle, this is good for your chicken, and then this can be mixed with the feed, and then this is a quite informal market may exist. I have seen quite few. And then also that farmers are not necessarily going into the pharmacy to buy those drugs, but then more like coming from this middle person, that the distributors to buy. So I think that there could be some very much system-oriented issues. But then I think that, in my opinion, that one of the solutions, not solve everything at once, but then one of the approach to solve this issue is actually for this residue monitoring, because then we will start seeing the indicators that what drug residues with what commodities are found where, and then we can start seeing some patterns. Then we may be able to address the each issues, the systematic issues, or this informal market issues, or knowledge issues of the farmers. There could be a different reason why that use of the antimicrobials are not so correct. So I think that tackling each different issues by looking at the scientific data, I think that will help you understand and start solving the issue.
Thanks again very much, Masami. Thanks for all the people who have stayed with us following the interesting talk until the very end. I think with this we have to close our webinar. As we said at the beginning, you will all receive Masami's presentation and the link to the registration of the webinars. Please don't forget to fill in the questionnaire that is posted in the chat box. Give us your feedback. We need very much to hear about you, and if you're interested, to get in touch with us and to share the result of your work, your research, and so on, please write to us and be our host in the next webinar. That said, we are going to keep on doing the work, so you're welcome and keep tuned, and you're welcome to join us for the next webinar that is going to take place in October. Next slide, please. Or the previous one. Okay, that is going to take place on the 9th of October, this time in the Central European summertime afternoon, to make it easier for the people in the American hemisphere to follow it. So from 3 to 4 o'clock Central European summertime. On 9 October, we hope to have you there. Thank you again. Thanks, Masami. Thank you all.